Good afternoon. Welcome to HUD 2022 Data Changes Training. My name is Nicole King, and I'm the HMIS Administrator at ViaLink for the Unity COC. First, we're going to start with some important things that I need you to remember going forward. Relationships ahead of household is continuously becoming more and more important. It is the way reports connect, as well as it can cause many errors for us in federal reporting. It is very important to ensure that you pick a head of household for every individual in a family, or even if the person is alone. Please make sure that you put the relationship to the head of household, or if that person is the actual head of household. Client location is also very important to remember for Orleans and Jefferson Parish. The client location is always LA 503. Race and gender. Race and gender is also becoming more important as well as it helps to connect the different reports. And when these questions are not answered, it actually will bring on errors that can harm our federal reporting. We will go into further information about what are the big changes that we have for race and gender coming forward. Data completeness. It's very important to ensure that you complete whatever assessment is available for your project, for your entry. Please make sure that you answer everything according to your specific grant. Data accuracy. It's important to make sure that all of your data is accurate going forward so we can ensure that there are no data errors. Please continually check and monitor your data, and you can do that through our APR. And it is suggested to actually to run your APR report weekly if possible. If not, monthly would be great. Lastly, data timeliness. Please always remember that for our data timeliness, it's important that you upload and do all of your data intakes within 24 hours into ServicePoint. It is a requirement for our continuum of care. One of the first big changes we have for the 2022 data standards is gender. Gender has a few new responses, and I'm going to go over all of them. The responses for gender now will be female, male, a gender other than single, female, or male, which can include non-binary, gender fluid, agender, and culturally specific gender. Also, we have transgender. Before, you probably remember that it was broken down for trans to female and to men. Now it's going to be transgender overall. Another new response is questioning. Client doesn't know, client refused, and data not collected are still on the assessment, but it will not be available because it is asked that you actually answer this question now. The other thing to remember for this, now you will have the option to pick multiple genders for any of your clients. Race. Race has had additions added to each section, which to make things a little more open when doing responses. The new races include American Indian, Alaska Native or Indigenous, Asian or Asian American, Black, African American or African, and Native Hawaiian or Pacific Islander. Ethnicity changes include non-Hispanic, non-Latin AOX or Hispanic Latin AOX. It's no big changes outside of the AOX being changed and included into the ethnicity to be more inclusive. Relationships are head of household. As we discussed earlier, there must be at least one, but not more than one head of household for each enrollment. Another change is due to mental health disorder. It used to be mental health problem, and it now has been renamed to mental health disorder to be more inclusive, as well as more open to the different issues that people may be struggling with. Substance abuse disorder. Alcohol abuse has been renamed to alcohol use, drug abuse renamed to drug use, as well as both alcohol and drug abuse has been renamed to both alcohol and drug use. Coordinated entry event changes. We have some new responses, and those include referral to emergency assistance, flex fund, furniture assistance, referral to emergency housing voucher, referral to a housing stability voucher. HUD COC only required elements. This will include, we're introducing three new data elements to the HUD COC only required elements, and those include well-being, moving on assistance provided, and youth education status. Well-being question will be a question that needs to be answered by PSH programs, and it's available at the head of household project start, as well as at annual assessment and project exit. There will be no more information on the well-being questions at this time outside of the questions and responses that I share with you in 1 second. The first question will be client perceives their life has value and worth. The second question is client perceives they have support from others who will listen to problems. Client perceives they have a tendency to bounce back after hard times. And clients' frequency of feeling nervous, tense, worried, frustrated, or afraid. The responses for all of these will include strongly disagree, somewhat disagree, neither agree nor disagree, somewhat agree, strongly agree, client doesn't know, client refused, data not collected. Moving on, assistance provided. This will include a COC PSH programs, and this will be at the head of household as well as at occurrence points. And this will include the date of moving on assistance as well as the type of moving on assistance if these things are available. Youth education status. This will only be available for the COC YHDP programs for head of households projects, and it will be available at Project Start and Project Exit. And those questions include Q1, current school enrollment and attendance, most recent educational status if not currently enrolled in any school or educational course. The responses will include not currently enrolled in any school or educational course, currently enrolled but not attending regularly, when school or the course is in session, currently enrolled and attending regularly, when school or the course is in session, client doesn't know, client refused, and data not collected. W1 services provided, HOPWA, has had an updated wording change. Substance abuse services slash treatment is going to be renamed to substance use disorder services slash treatment. Also with HOPWA, under medical assistance, there are new questions, which include receiving public HIV/AIDS medical assistance. If no, for receiving public HIV/AIDS medical assistance, the reason. Receiving AIDS Drug Assistance Program ADAP. If no, for receiving AIDS Drug Assistance Program ADAP, the reason. Receiving Ryan White funded medical or dental assistance. If no, for receiving Ryan White funded medical or dental assistance, the reason. This will all be head of households with HIV and AIDS, and this will be found at the project start and update as well as the project exit screens. Also under HOPWA, prescribed retroviral is going to be a new element. And with this element, you will find, has the participant been, been prescribed antiretroviral drugs? Responses will include no, yes, client doesn't know, client refused, data not collected. This will be for HOPWA, all household members with HIV and AIDS, and this will be found at the project start, update, and project exit. Under RY, for RY 13 family critical issues, there will be an updated wording on question names. This will include mental health problem, family member is renamed to mental health disorder family member, alcohol or substance abuse disorder family member renamed to alcohol or substance use disorder family member. RY R14 service connections also has an updated wording. Substance abuse disorder renamed to substance use disorder treatment. Substance abuse disorder ed prevention services renamed to substance use disorder ed prevention services. For SSVF, under V3 financial assistance, there was a merge general housing stability assistance emergency supplies into general housing stability assistance other, and a rename to General Housing Stability Assistance, removing the other option. Also, there was an add to food assistance as a pick list option. Also for SSVF, V7 HP targeting criteria. This will now include, is homeless prevention targeted screener required? housing loss expected within whatever amount of time, current housing household income, history of literal homelessness, street, shelter, transitional housing, and this is for any adult. Head of household is not current leaseholder. Head of household never been a leaseholder question. Currently at risk of losing a tenant-based housing subsidy or housing in a subsidized building or unit, also a household question. Rental evictions within the past 7 years, any adult. Criminal record for arson, drug dealing, or manufacture or felony offense against person or property, and that's also for any adult. Also, incarcerated as an adult, any adult in household, discharged from jail or prison within the last 6 months after incarceration of 90 or more days, adults, registered sex offender, any household members. Head of household with disabling condition, physical health, mental health, substance abuse that directly affects ability to secure slash maintain housing. Currently pregnant, any household member, single parent household with minor children. Household includes one or more young children, age 6 or under, or a child who requires significant care. Household size of 5 or more requiring at least 3 bedrooms due to age slash gender mix. Household includes one or more members of an overrepresented population in a household in the homeless service system when compared to the general population. These targeting criteria will be required for the HP, head of household, and will be found at Project Start. If you need any more help or more understanding about the different data standards changes, please contact the HMIS department team, and you can do that at hmisdept@vialink.org. There will be more information to follow. Thank you and have a great day.